Thanks for joining us tonight. I am Janice Allen. Thanksgiving will look a lot different this year for many families as COVID cases continue to rise around Michigan. Some of the most at-risk groups in nursing homes and assisted living centers are encouraged to stay put, but recent orders from the state health department do not prevent them from going out. Fox 17's Ryan Cummings explains the recommendations if you have loved ones that you would like to bring home for the holiday. Ryan?
Hey, Janice, we all know that being around family is important to a lot of people, especially during the holidays. But during a pandemic, that may not be the best option. For those, though, who are choosing it, there are some extra precautions to take.
It seems less safe now to take her out than it would have in the summer.
Karen Leinema of Jenison is talking about her mom, Pat Vanderweide. The 77-year-old's been at St. Anne's home in Grand Rapids since June of 2019.
At St. Anne's, they've been very helpful of trying to arrange visits for as much as we can.
This picture shows the last time they were in the building, March 11th for Pat's birthday. After that, they had to visit through the window. While it's not the best option, it provided some time away from isolation. Staff also brought Pat to this door at the end of her hallway, where the family could talk to her through the glass.
So they wheeled her down there, and then we use cell phones to talk, which kind of confuses her because she can't always make sense of the fact that we're talking and then the phone's going too, because there's a little bit of a delay. So that makes it hard for her.
The kids also wrote their names on this hug glove since they're not allowed to give her one in person.
It's hard not being able to give her a hug because I used to go at night sometimes to help tuck her in, and I'd give her a hug and say goodnight. And most of us already feel guilty enough for putting our parent somewhere. So it just makes the guilt even worse that we can't go visit.
St. Anne's campus has reported 46 COVID cases so far this year. Most are treated on site. Some recovered at local hospitals and COVID hubs around the state. The residents are tested once a week, while staff members are tested twice. St. Anne's was ready to switch to indoor visits, but COVID cases started to spike around the state. Staff tell us when Kent County is within visitation guidelines, they will allow them. Spokesperson Tim Bolson says we fully understand the ongoing burden and stress the limitations bring with them, but at the same time understand and support the need to protect the most vulnerable. We hope that all senior communities, their residents, their family members, and local and state officials continue conversations focused on solutions, whatever they may be. MDHHS recommends people stay in place and not go out, but there is nothing in the order preventing them from doing so. If people leave, the agency wants care facilities to make sure they social distance when they come back, wear masks, limit contact with common spaces, and be screened upon their return. Pat got married in 1965. Out of everyone in this picture, she's the only one left. That's why Karen's joined a community group to speak up for those in care facilities, even reaching out to lawmakers so they understand the impact of their decisions.
People that don't have somebody in a care facility don't understand what the effect is having on our loved ones and on us, because a lot of our loved ones they're staying safe from COVID, but they're lonely and isolated.
And that is sad for a lot of families tonight. Now, Karen tells me that her mom has been tested multiple times. It was negative every single time. Now, while she's not taking her out for Thanksgiving, she does hope to possibly do something for Christmas, maybe get her out of the center for a couple of hours. You can read the full order from MDHHS and its recommendations online at fox17online.com. Just click on the story. Reporting live in Grand Rapids, Ryan Cummings, Fox 17 News.